Hi, this is Dr. Bharadwaz. Today to our program, Health Authentic, we are inviting one of the greatest doctors in emergency health field. His name is Dr. Ranjith Kumar Konduru. He is an emergency specialist. He did his MBBS from JSS Medical College, Mysuru. He did his Masters or PG in MRCEM from Apollo Hospitals, Hyderabad. He worked in many corporate hospitals as HOD for emergency department. He has handled some lakhs of patients and he has trained some thousands of common people to handle emergencies, to give first aid in emergencies, and he was the instructor for or the teacher for many of the doctors who are in the field of emergency. Now he started his own hospital, Sri Teja Hospital in Manikonda, Hyderabad. Today from him you will know all the basics of emergency medicine. We will be knowing how to handle few of the most common emergencies like heart attacks, brain strokes, snake bites, drowning in water, burn injuries, how to handle burns, how to handle when someone got poisoned, snake bites, and also epilepsy. Epilepsy means fits, how to handle the patients with fits, and lot many common emergency conditions, how to give first aid and how to handle in emergency states before the help or the ambulance arises. And also he will be diving deep into the latest techniques of CPR, cardiopulmonary resuscitation, where you will give breathing to the patient or you will start the heart of the patient again. And also in case of choking, how to handle choking in kids and adults. You will know practically all these details from the expert itself. This is your program, Authentic Health. Enjoy the show.
So this is a person you've seen unconscious.
Okay.
If you don't know anything, it's a roadside person who
Okay.
at home also.
Okay.
So what you need to see, before approaching the patient, see the scene.
Okay.
So is the scene safe for me to go and rescue, and is the scene safe for him to go and rescue? Like in a water or middle of the road, it's not safe for both of us.
Right.
So we bring him to the safety, make him lie down. Okay.
Okay.
So now we do a check. Okay.
Okay.
Hello sir. Hello. This is how you call him.
Okay.
So 2 times. Hello sir. Are you awake? Are you okay?
Okay.
So if you know the name, you call by the name. Otherwise, hello sir, hello madam, or whatever in Telugu also you can whatever. So now after checking that, you know that he is not responding to you.
Okay.
He is unconscious totally. So now you have to check the pulse and breathing. So how will you check the pulse? So I just for demonstration purposes I am lifting it here. We have a nipple line here and the midline here in the neck. Okay. Where we do compressions is here with the junction of nipple line and the midline. This is where we do the compressions. But where do we check the pulse is here. See, if you see your Adam's apple here, sir, you do palpate Adam's apple. Okay. So now slide it to the left or right. In the first dip, put your 2 fingers like this and then press.
Yeah, I am able to find my pulse.
Okay. Now that you have checked on the one side, check on the other side, sir.
Okay.
Can you do it?
Yeah.
Same way in the patient also you will have to identify the Adam's apple here and then slide first dip, go and press with the 2 fingers.
Okay.
Understand? So now don't go very back here, you will not be able to see. So it's just beside the Adam's apple here. Okay. So now I use my both the hands very wisely here because we are running out of time for the patient. So now my 2 hands on the when I am on the right side of the patient, I use my left hand to check the pulse. I'll use my right hand to put on the chest or the abdomen to see if it is moving for breathing.
Okay.
So like if I am putting myself, if I am breathing, my hand will move like this.
Right.
So like that, if the patient, if you put a hand like this, it will move up and down if he is breathing. So I'll check the pulse and the breathing at the same time for about 5 to 10 seconds, just like this. 1, 2, 3, 4, 5, 6, 7, 8. I am not able to check the pulse.
Okay.
I don't feel a pulse, or I don't have, the patient doesn't have a pulse. These 2 scenarios, you can directly go and start the CPR. But before going this, you will have, there is another very important step called calling for help, sir.
Okay.
So no one should forget this. So once you identify the patient is unconscious, the second you do that, you have to ask, please go call for help. Like if you are there beside me, sir, please call ambulance.
Ambulance. Okay.
108 or nearby whatever the ambulance is there, nearby whatever is there, please call for help. So the minute they you do say that, there is a way to asking for help. So you call for ambulance and you will tell exact location where you are. So the road, the landmark, so that they can, what is the route to come to that particular place and how to go about from that particular
Yeah, maybe we can share the location as well.
Yeah, that is it. If it is very difficult for them, we can share the location. It's very easy now because of the smartphones.
Yeah.
So, but 108 sharing location will be little difficult.
Okay.
What you do is you should tell them the landmark first, so that they'll identify which ambulance is nearby that one, and they'll dispatch. Once the ambulance is where, that person will call you. Then that is when you can share the location to them. Okay.
Yeah.
So in that way, you can call the ambulance. The minute the ambulance is called, then again you should come back to the patient. If you are alone, not any person, so that is your job to call for the ambulance and then do the things simultaneously.
Okay. Yeah.
Okay, so that's
maybe switch on the phone, keep on the speaker,
yes,
and do
yes,
both things simultaneously.
Yes, yes. If you have a Bluetooth or something, yes, you can speak over the Bluetooth. It's very easy. Or you can put like this and then you can do. That is easy.
Okay.
So once you know how to do things, it's very easy to how conveniently you can perform that person. So now that we have known that there is no pulse and there is no breathing, you already call for the help. The next step and important step would be the doing chest compressions. As I told you, CPR means cardiopulmonary resuscitation. So cardio is restarting the heart, pulmo is restarting the breathing, resuscitation is giving a life again by restarting. Okay. So now, as I told you, where do I do compressions? It's a nipple line in the midline of the patient. So I use my hand like this, dominant hand. My dominant hand should be like this. Put my fingers like this, and the non-dominant hand will come and close my fingers like this. And then you should be perpendicular to the patient. That means my have to be straight to the patient, not like this or like this or like this. Your knees, elbow should not bend. It should be straight. So like this. So okay, now I can do the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I can go for the breathing. So I'll demonstrate you the breathing after this compression. So why don't you try once?
Yeah, so this is my dominant hand. So I keep this in front and I will keep my non-dominant hand like this, and I will ensure my elbow is not bent. So I need to
little more bending onto the patient, sir.
Okay.
Perpendicular, and the elbow should be straight.
Both
this is the
elbows
perfect
should be
position.
straight.
Yes, this is the perfect position. Yes,
Okay.
sir. Do
1, 2, 3, 4, 5, 6, 7, 8, 9.
See,
10,
what
11,
you should
12,
remember is
13,
the force
14,
should not come from the
16,
shoulders,
17,
from the
18,
elbows,
19,
but from
20,
the shoulders,
21,
and your back should be moving. Your weight should be falling on the hands rather than only the back moving. Okay, that is more important.
Okay.
Okay, otherwise you will get a backache later on. So otherwise it's very important that your weight of the body will fall on the patient rather than you pressing the patient. You should not use any muscles as such. The weight should do the work.
Okay.
Okay. So now that you have done the compressions, we will do how to do the breathing. So ideally the breathing would be mouth to mouth, but if you are loved ones or if you are at home, someone who you care about, yes, you can directly go and do the mouth to mouth. I'll just show you how to do a mouth to mouth. Okay. So first thing is you have to pinch the nose of the patient.
Okay.
And you have to seal your mouth around that person's mouth like a normal breath. Don't take a deep breath. Don't do that. Like a normal breath. And then seal and then blow slowly. Don't do. Example, if you take a full glass of water and blow it, what will happen, sir? It will spill on you. If it is a hot coffee, how will you do?
Okay.
So it's just like that. So it's okay. That means just a small blow, release of your air into the other person's mouth. So that, and when you are doing that, you have to see from the corner of your eye, you have to see the chest. It will slowly raise. Like this.
Okay.
So that means it is a successful
breathing.
Okay. So when you do that, you have to open the airway. When you know that airway and foot pipe both are side by side.
Right. Yeah.
And they have a connection in between like this. Okay. So now to make the airway straight, you have to tilt the head like this.
Okay.
Like this. So you have to hold the chin and lift it.
Okay.
So you lift it and then tilt the head. So this is called chin lift and head tilt.
Okay.
Okay. Chin lift and head tilt. Okay. So now can you see this mannequin? Just like this. In this way, like if you are smelling something, you do like this. Why you do like this? Because you are opening your airway.
Right.
You are taking the breath. So that is the reason you have to do chin lift and head tilt. Close the pinch the nose. And then, if you are afraid to do that, you can put your hold like this. You can even do that.
Okay.
But there should be a perfect seal. If there is a seal, the air doesn't escape from outside. If there is no seal, the air escapes. So whatever you give will not be going into the patient. Okay, that is how you give the breaths. So give 2 breaths, sir.
Okay.
and you see the chest is rising.
Okay.
Okay, now one set of compressions, 30 compressions, one set of 2 breaths. It's called one cycle.
Okay.
So you do that for 5 cycles.
Okay.
You should be able to finish this in about 20 to 30 seconds.
Okay.
So usually the speed of compression should be 100 to 120 compressions per minute. That means in a second you should be able to do 2 compressions.
Okay.
That is the speed. In the even the breath you have to give it in within 2 to 3 seconds.
Okay.
So once you give 5 seconds of this one, 5 seconds of this one, you will take a gap of about 5 to 10 seconds again.
Okay.
In that 5 to 10 seconds, if with both are there, now I have done the compressions. I will come to the head end and you will come to the chest compressions and you will do the compressions.
Okay.
We will change because there is a thing called compressor fatigability. That means when I am doing compressions for more than 2 minutes, I usually get tired.
Okay.
I may not know it, but my strength of compressions will definitely come down.
Okay.
So that's the reason it's called exchange.
Okay.
So compressors will get exchanged and then the other person will do the compressions, then I will do check and breathing in that particular minute.
Okay.
Okay.
Yeah.
So that means you have to change your position for the compressors for every 2 minutes or 5 cycles.
Okay.
So whichever is earlier. Or if I am tired, then immediately I have to ask, okay, I am tired, why don't you go ahead? It's not about numbers here, so it's about giving quality compressions and breathing.
Okay.
That's what we are doing here. So the minute you do here, every 2 minutes you stop and change yourself, you check your breathing and pulse at the same time. So like I did earlier, you have to do this like this every 2 minutes. So once if you get the pulse, that means you have achieved what is called return of spontaneous circulation. That means return of pulse. Return of pulse where the patient can start breathing, may not be able to start breathing. So if he is able to breathe, leave him like that and wait for the ambulance. If he is not breathing, but pulse is there, definite pulse is there, then only support the breathing like I told. Every 5 to 6 seconds, one breath, we can keep on giving him until the ambulance arrives, and every 2 minutes you keep on checking both pulse and breathing every time. So this cycle will go on, like 2 minute cycle will go on, you have to remember that, and then every time you check both pulse and breathing has to be checked. So if pulse is there, breathing is not there, support the breathing. If pulse is not there, breathing is not there, support both of them by compressions and breathing. So in this way your CPR is actually complete.
Sir, I have one question. Why do we pinch the nose? Can you explain?
Yes, see, as I told you, the minute we are blowing, air has a very tendency to escape through holes.
Right.
Okay, so wherever there is a leakage, air escapes. So if you don't pinch the nose, the air escapes through the nose.
Okay.
Whatever you are blowing, it will come out through the nose.
Okay.
So which we don't want.
Yeah.
We want the air to go in. So that is the reason we tilt the head, lift the chin, pinch the nose, put a tight seal and then do it. As you asked earlier, doubt, if it is a roadside person who don't know who might be having infection or anything, we don't know what it. So post COVID, it is a recommendation to give a breath. We can give it through a barrier. You can use a handkerchief, or you can use a small plastic pipe and you can seal it up and down here with 2 hands, and then probably you can blow.
Okay.
Or you can see it's Indian jugaad.
Right.
You know whatever you want to do, you can do. But ideally, it is to be done mouth to mouth or mouth to mask.
Okay.
Any other doubts, sir, in this?
No, sir. I think everything is clear. So now everyone who sees this video are ready to give a CPR.
Yes,
In a
and
perfect
always try to practice on a mannequin whenever this. We did a recent camp. We have good attendance, sir. Everyone learned how to do it, and they were very happy on doing it. So this mannequin is available with us. Whenever they want to come, they can come practice here and they can go.
Yeah.
So that we can do in that way. So because learning first aid CPR saves a life. Unfortunately, if you remember, our president, beloved President Abdul Kalam sir, has collapsed on the stage, but none on the stage has done CPR there. If they would have performed, probably would have still had him here now.
Right.
So that is the importance of learning CPR. Every person should know this. Every person who sees this video, please try to learn it and then teach to many other people, so that this is a very basic skill. Basic skill like drinking water, like cooking, eating food. It's a basic skill. So you have to do this, then only everything will fall in place.
One more common scenario is burns. So we see a lot of burns cases, and someone asks them to put on the ice or put some water, or even some people put some milk. They will wrap them in a cloth or in paper. So we want to hear from the expert on the burn injuries, how to handle
the first aid.
burn injuries.
First aid for burns, actually. Sir, burns is a very huge topic. The burns can be because of many things. So one is fire, which is more common, which we see. And the second most common household item is hot oil. Okay, and the third most common is hot water.
Okay.
What we see is they'll carry the baby in the arms, and then they'll carry a hot item in another hand, and they'll be going. Baby will not stop still, so he'll put his hand in the hot things. So we see burns of the hands. Another is they are boiling water for the kids and they are carrying it. The baby suddenly comes into your legs and you tend to spill it on the baby. That is another thing. And without testing the hot, you can put in the baby in the water. So these are the baby, regarding the baby. And other main things are hot oil. When you are cooking, so what you want to do, you want to switch on the stove, make the oil heat, and then start cutting this. So you are in a hurry to do things. So you just splash it. All hot oil will splash on you. So this particular ways you get exposed to the fire. And the third most common which we see is the cloth getting in the deepam. The edge of the cloth gets fire and then it spreads onto your body during puja, and especially when you are having a puja in the closed room, and then and then other fire is like burning yourself with a suicide. So this fire can be because of any other substance, can be kerosene, petrol or oil or anything. So depends on what type of thing you are exposed to and how much time you are exposed to and where you are exposed to defines your damage for burns.
Okay.
You understand, sir? So if it is a petrol burn on one type of temperature, it can gain. If it is a kerosene one, it can gain up to one temperature. If it can oil, it can come one. If it's cloth, it can gain up to one temperature. If it's another gas, it can be another temperature. So it depends on how much temperature it can attain and how much damage it can do on your skin.
Yeah,
instant damage.
On the temperature, the damage
the fire,
is assessed.
yes, the fire, especially the fire. The temperature it can reach, that will damage your skin or the organs. The heat you inhale can damage your whole respiratory system. Eyes, it can burn. Hair, it can burn. Face, it can burn. So it depends on the fire, the amount of fire, the time of exposure. Is it instant or is it longer time? And how much extent on the body are you getting affected? If it's a chemical burn, how much chemical spillage on your body? Once the chemical is spillage, how much time is it in contact with you? Was there any cloth in between or only on the skin, direct skin? So the amount of injury is always estimated with these many factors. It's not a single, okay, I have got a burn, no, it's not like that. So each burn has a different type of first aid. Look, chemical burns or acid and alkali burns are usually very, very, very problematic. They burn instantaneously, they damage your tissues instantaneously. The best way is to just put your hand under the tap water and clean it off. That's the first step you can do. If it burns, just put some ice on it, so that it doesn't hurt you much. But once you clean off the thing, if there is no more acid or a chemical which is hurting you, then you can start putting ice or cream or milk or whatever household things if you want, you can put, as long as you are not contaminating the wound. Okay, so you can do whatever it is just to relief. That is only for a pain relief. It doesn't treat the burn. It doesn't make it go away. If it is a fire burn, so you have to put it off fast. As I told you, the contact time. How you are putting off doesn't matter, sir. You have something in your hand, cloth or something, put it off, because the problem with the cloth is it sticks to your skin once that is off. So it's very difficult to remove. The skin comes peeling off. So water is better thing. Just pour the water, because that means you are stopping the ignition agent. That means the firing source. The firing source here is either oxygen or liquid itself. So once you remove them, once you put off the oxygen, there is no source of fire, so fire gets controlled. Put off the source is what we say. Okay, so once you do that, you stop the exposure. That means you already stopped half the damage. So whatever the damage has happened, so there is nothing much you can do at that particular minute. So give them only pain relief is what we see. So even if you come to the hospital, what we try to remove the exposed material first, and then try to assess the wound and other, then we can start treatment to the patient. And there is nothing much you can do about burns at that particular moment when it is happening, sir, apart from stopping it and preventing it. Of course, preventing is the first step. So when you're in your home, if you're cooking, stay a little far and then cook. Don't do it in high flames, and you should know what you are doing.
Be careful when children
are around. And even if you want to warm the water for children, why do you want to make it super hot boil? Okay, so make it just warm and then bathe with them and put them in another room when you are doing this one. After this is done, then you can bring the baby. always test it on your skin before you give it to baby. Even milk, when you boil the milk, always test it on your skin and put it 1 or 2 drops and see if it is warm or hot. Then feed the baby, and that, because it's very important that you don't give extreme temperatures to kids. It definitely hurts them a lot. When you're cooking at home, open your windows and don't do in a closed room. So that when you open the windows, even if the gas leakage, it goes out rather than stays in one single room. So if you smell gas leakage, don't switch on, don't plug on this thing. So these are the basic precautions and first aid things you can do for burning.
And one more common thing Indians do, no other person in the world do it, keeping turmeric onto it. So what's your opinion on
Sir,
putting some turmeric onto it?
Sir, as an allopathic doctor, I don't advise turmeric to be kept, but it is one first of known antibiotic for us from ages. So there's no comments on it as such. Okay. But for me, if I am receiving a patient with a turmeric on a wound, it is very difficult for me to clean and do a first aid for that particular wound.
To tell it straightforward, don't keep it.
Avoid keeping it.
Okay. Yeah.
I won't say don't. I just said avoid.
Yeah. Great. I have seen a case where I was in school at that time,
yes,
and
sir.
There was one small guy selling something in a small cart outside, and he went into fit suddenly. One person came and gave him the there was a tailor, and he gave him the
iron things to hold.
Scissors. Which one? And he hit him like this. So he kept in his hand and he directly with the scissors he hit himself.
No.
So it should not be done, but we want to hear from.
Sir, here again, seizures, we call them as seizures. Yeah. A person who is suffering long term with seizures, they are called epileptic. Okay, epileptic. So the word is epilepsy, what you said is right. And the actual movements, the rhythmic movements of the body are called seizures. Okay, so I'll tell you one thing, please remember, seizures cannot be stopped without medication. Ongoing seizures cannot be stopped without medication unless and until they stop on their own. Okay. Usually any seizure episode comes about 2 to 3 minutes up to 5 minutes. It will stop by its own. Okay, it's just nothing but abnormal brain waves which are asking your body to move rhythmically, and the patient becomes unconscious. He doesn't know anything. Sometimes he bites his teeth, he uprolls his eyes. Sometimes only hand will move, sometimes whole body, both the hands, and sometimes one hand will move and then again going back to the whole body. So it's called focal going on to general tonic-clonic seizures. So when they stop on their own, people think that because I put something in his hand, it stopped. Exactly, what you said was right. Putting something, sharp things in the hand with the rhythmic movements, they harm themselves. And don't try to hold them hard, because we have seen shoulder dislocations, fractures when you try to hold the movements. So when you try to forcefully stop the movements, they undergo fractures. They go and falling down from a standing position can cause shoulder injuries. Shoulder dislocation, shoulder fractures. We have seen many cases who come with shoulder fractures, and then they bite their tongue and they try to stop the mouth to prevent the tongue with them, but their fingers get cut because of the strength. Okay, it's all muscle contracting so hard that whatever comes in way will be bitten. Okay, so if you try to put something hard in the mouth also, the patient's teeth will get damaged, tongue will get damaged, he can get aspirated because of that. Okay, so what can be done in this situation? So what can be done is we call it as recovery position. Recovery position is nothing but make the patient lie down flat on the floor or any flat surface, turn him to one particular side. The best is to turn onto the left side, because the stomach is on the left side, the curve is on the left side. So when you do this, the stomach also goes down, it prevents aspiration. If this is not possible, on the right side is still okay, but when you do that, whatever comes out will come to the side and fall on the ground, preventing him to aspirate. Okay, preventing him. So that is a major risk. Any seizures, lack of oxygen and aspirating fluids are the major things which gives the damage. Okay. So it's like, if you can't prevent aspiration, that means even if the brain is working, your lungs will not work.
Yeah, what you mean by lack of oxygen is due to
because of the seizures. If it goes on longer time, so sometimes breathing is affected and the oxygen may not go to the brain. So as I told, it is usually self-limiting. But within 3 to 5 minutes, the seizures calm down. But if you don't give medicine within this time, so it can reoccur again and again. Sometimes it comes without any stop, without complete recovery. It comes. That we call it as status epilepticus. That means it's a status. That means the brain is, the waves are not stopping. We have to stop them by giving medication. So most of the times in the hospitals, in the emergencies, They put an IV in your veins, and then they give medicine through the vein. Sometimes when it is not found, when it is the still movements, they can give through the muzzle, in the Precaution muzzle and give. They can have a sprays, nasal sprays. They can put sprays in the nose so that the medicine is gone into the body, and then fits stop. So we have seen every kind of seizure patient. I have seen every kind of seizure patient. They respond to one medicines. But it is very important, as you told, don't hold them down. Don't put anything in their hands. Don't try to stop biting his tongue, and don't try to force open do things. Just put him in the lateral position, preferably left lateral position, and then whatever the position, which side is there, that hand should go straight under the head like this. The other leg should come to the body like this. This is called a recovery position. This leg should be straight and this leg should bend. That will prevent from falling back. Okay, so that is how you should do. That's called recovery position. So any unconscious patient, any semi-conscious patient, any fits patient who is having seizures or fits should be in this particular position to prevent aspiration.
One more common thing is snake bite. So normally what they show in movies is just cut open with something, suck it with mouth and spit it outside, and tie just above the snake bite with a tourniquet. So these are all the things shown in movie, and also we have studied some of these things. So what is the latest protocol on it?
Okay, sir, what happens when a snake bites you? Okay, what will kill you the fast? A, the poison of the snake. B, sucking and doing all these things. So 3, your fear of dying. Or 4, all of the above, none of the above. So I will tell you which will kill you fast is your fear.
Okay.
Fear kills you faster than the poison, sir. Believe me. Okay. So what we tell people is, when something bites you, don't get panicked. Panic kills you faster. Okay. So now a snake bit you on the leg. Okay. The poison there in the leg has to be taken up into the veins, and it has to be transported from there to the heart, and then from there, from arteries, it has to go to all your body. So it is time taking. It's not immediate.
Right.
Okay. So it is time taking. So it takes some time. So don't panic. Don't be in a hurry. Okay, will die. Relax. Now, as you said, what are the first aids can be done? So earlier they used to bite and spit it out because the poison which is entered into the skin, they want to remove it. That is the purpose they were doing it.
Right.
Then now it has become a different scenario where it became a fashion to do things. No, it's not necessary. Don't do that thing. If you are doing, that means you are taking the poison into your body, which is bad. Instead of patient dying, you will die. Understand, sir? So don't do that. Don't put an X mark. Don't put cut things. Don't suck things. Leave it at it. Okay, so that is first part. Second part, you want to tie a tourniquet. So there are 2 types of tourniquet. So one is a venous tourniquet, one is arterial tourniquet. Okay, so arterial tourniquet is where you tie it at least 5 inches above your site mark. With your hand inside the tourniquet, tie it tight. Understand? Then you remove your hand. That means it is not tight enough to prevent the circulation.
Okay.
So leg will not die.
Okay.
Only the blood circulation will be stopped, but arterial circulation still will be there.
Okay.
So you have to put 1 or 2 of your hands and then tie above it. Then you remove your, so it is tight enough to stop the spread of the poison. That's called venous tourniquet.
Yeah, it will stop the venous blood returning into the
heart,
systemic circulation.
It will stop. It will slow down. Yes, slow down the circulation. That is one thing. And once you tie this, every 1 hour or so, you have to release and then tie it back.
Okay. So what is the reason for
Reason being is, if you don't do that, your whole venous blood is accumulated in the leg. So it will swell and it will cause cellulitis.
Okay.
It will cause the infection of the leg and you will lose the leg, believe me.
Okay.
So that is the reason you have to release it for some time and then again tie it back if it is required. That means if it's taking more time to reach to the hospital. Okay. And then again, so when it's in the leg here below the knee, the whole body is at one level and you can put the knee, only knee down position.
Okay.
So that again the blood circulation is little
slowed.
Yes, it has to come up and travel
the gravity.
Yes.
It slows down.
Yes. If it cannot do that, okay, put a splint to the leg like a fracture.
Okay.
Put a splint to the leg and try to immobilize it.
Okay.
Because if you try to move the limb, it increases the blood flow. But if you immobilize, again the blood flow is slowed down. Spread is slowed down. So once you've taken care of these small things, patient will not die of snake bite. The snake poison will kill you in two types, sir. One is neurotoxin, one is hematotoxin. That means neurotoxin is nothing but the snake makes you paralyzed. It will make you stop. That means your heart is still beating, but you can't move. That is a neurotoxin. Hematotoxin is where it will bite you. You'll start bleeding from the wound. You'll bleed until death. If you don't stop it. That is how the snake bites kill you. That is how they eat their prey. Understand? That is their mechanism to hunt. Now, we know the mechanism. We know the poison. Just we give anti-snake venom, he'll be alright. So that means we are giving a medicine to stop the poison to act on your body. If it is a neurotoxin, we'll put you on ventilator, we'll give artificial breathing. So once the toxin effect is over, you will be alright. So there are advanced ways and there are many studies, much more experience we have in treating snake bites or any other bite in fact. The only thing is you need to approach the right place to get the treatment done.
So coming to the poisons, when someone takes the poison, inhales the poison, something, normally people tend to give water dissolved with salt so that they will vomit. These type of things people do. So what's your opinion on what to do when someone takes poison?
Sir, it all same like drowning, So you're trying to remove everything from the stomach is what you are trying to do, okay? By giving vomitus, by initiating vomit. Bad, again bad. So patient doesn't die immediately because of the poison, but he will die because of the aspiration if he aspirates into the lungs. So always avoid making them vomit. No, it's absolutely no. Don't let them vomit as such. If they vomit on their own, yes, again recovery position and then making them bending forward and making them stay in that particular position until the whole thing comes out. That is the only thing you can do. Okay. Again, if it is a chemical, it's not only goes into the stomach, but it falls on the body also. If you really want to help the patient, clean him, change the dress, clean him first. That will stop 50% of the transmission of the poison into the body. Okay. And within 1 hour, that's called golden hour. If you come in that particular hour to the hospital, we have a small tube for few poisons only. You are supposed to do this and put a small Ryle's tube into the nose and then try to clean the stomach. We call it a stomach wash in a controlled environment because we know what we are doing. The patient will not aspirate when we do that. Okay. So in that particular scenario, only we recommend a stomach wash, but otherwise no, it's an absolute. And there are some acids and alkalis, caustic materials where you are not supposed to put Ryle's tube. It does more damage than benefit. And if it is something like evaporate, like kerosene, it evaporates, petrol evaporates. So when these are evaporate substances, it's not the fluid in the stomach itself which will kill you, but the vapor which causes your lungs to breathe and it causes damage in the lungs. So that will kill you more than this one. So avoid, if you in this kind of vaporized materials, if you are there, you wear a mask and approach the patient. It's always better going to patient 1 minute later than going unprotected by yourself. So, and then absolute no for a vomiting, and then within 1 hour if you can reach to the hospital, they will know which kind of medicine it is. Always carry the bottle or whatever the item which person has ingested so that we have some antidotes available. They can give immediately to that particular patient in whatever the way it is required, and they'll definitely require an absolute professional way of helping for poisonings, not just a lay kind of thing, sir. It will definitely harm the patient than benefit.
Next, coming to the RTA. So normal thing we see is bones coming out and a lot of bleed. So what should be done when they see the bone outside or a lot of bleeding is there? So what's the first aid to be done in that case?
Road traffic accidents, we call it as RTA, road traffic accidents. There are 3 types of ways the person dies. Okay, the 3 modes of time, like instantaneous death. Instantaneous, the minute you met with an accident, you died there in the scene. It is most likely because rupture of your great vessels, like bigger blood vessels, they rupture and bleed and you die immediately. Or you have major loss of brain, the spinal cord break or brain damage, vein coming out, stomach coming out. See, again, the amount of damage depends on what speed you were and how you met with an accident, like from the side, from back, from front, from above, from below, or how you are sitting with seat belt, without seat belt, or with a helmet, without a helmet. So depends on what protection you are wearing, what precautions you are taking, how much speed you were, and where you were sitting, front of the car, back of the car, or in the middle of the car, what things around you which were causing compression or damage to you. So the damage to assess in every RTA is very different, because every accident is unique and no two injuries are same, no two persons are same. So each and every injury, each and every accident should be taken in a unique way and it dealt with in a unique way. So as you said, yes, when the person is meeting with the accident, the first way of dying is instantaneous death, where these major organs get ruptured or injured, they'll die immediately. And the third way, I'm skipping the second way because I'll come to the second way, it's a big explanation to give. Third way of dying is because once you survive the accident spot, you go to the hospital, you get treated and you get healed. But because of the injuries which you have occurred, you might be bedridden or not bedridden or something, you lose your limb or something, and then you get infections secondary to the injuries.
Okay.
So that will kill you as a third cause. Okay. First cause is by instantaneous death. Third cause is by the later time where you suffer with injuries and infections. So, and the second, which is again the most preventable way of death for accidents, is the golden hour death. So, there are certain causes in trauma can be treated in the first 1 hour of the accident. That's why called as golden hour. If in this time, if the person is taken to the hospital and those life threatening injuries can be identified and treated, the patient will live.
Okay.
The patient will live. Okay, so that is the reason this golden hour is very important. So the minute he meets with an accident, you have to take him to the hospital within the 1 hour. If there is any major things, we can treat the patient, he will be living. That's called golden hour. So please remember, yes, if the person meets with an accident, yes, you need to take him to the hospital as soon as possible. Okay, but there are many precautions to be taken here. As you said, bone comes out, he starts bleeding. Some people have fear of touching the blood. They get giddiness and they fall down when they see the blood, but doesn't matter. So the diseases which are in the blood cannot be transmitted to you just because you are touching him. If you are afraid, you can wear gloves, you can wear cloth, you can touch with that cloth. Okay, it can be wiped off, it can be cleaned off at a later time. Unless your blood touches his blood, usually the diseases don't transmit each other. But the naked skin, no, it doesn't come in that way.
Yes, skin is one of the greatest
barrier. Yes, skin is the best barrier for you to get diseases from outside. And most of the diseases which are there in the blood, once they are exposed to the outside environment, they don't usually live. Okay, the blood is continuously flowing, so they don't usually live. So don't get afraid that, okay, well, I might contract disease, especially AIDS, all these viruses. We tell them don't directly touch the blood, but still in a life-threatening situation, please go ahead and help them. Don't think in that way. That person may be 1 in 1,000 or 1 in 10,000, but if you save the other 999, it's still okay, right? So it's okay. Everything we have treatment and other things. Don't be afraid to touch the blood and so. Now, what can I do is what your question is. Yes. Always estimate the speed of the injury. What was the position? What is the position he is lying in? If you think that there is a spinal cord injury, the spinal cord is where from here to here your backbone. If you think that that is injured, so you should not mishandle him. When I say mishandle him, don't try to manipulate his head, try to lift him with limbs and then do it. No, just turn him aside, put a wooden plank behind and then put him on that, and then start carrying the plank from then on. Okay, that is the way you have to move the patient when you are suspecting a backbone injury. The best way of thing to do is to get an ambulance faster, and then they know how to transport a patient. They know, they're trained technicians, they're trained nurses in the ambulances, drivers. They try to move him in a safest way possible. Again, if the patient is conscious, transporting him safe is more important, as important as
treatment.
faster,
Okay.
faster transport. Both are equally important.
Okay.
So you can't tell that he is wasting time by putting that, putting this. No, they are very important. Putting a collar is important. Putting a spine board is important. Putting a wrapping with Velcro tapes is important. Securing him is as important as transporting him as faster. Both will save the patient. You try to be fast and damage his organs in the way doesn't make the patient live. You'll only brought him faster, that's all. But safe and faster is always the preferred mode. That's why ambulances are the best ones to transport a patient of trauma. But in Indian scenario, the fastest transportation mode is autos.
Okay.
So when I worked with many institutions, I trained almost like 500 to 1000 auto drivers in this first aid, so that we know that they are the people who are bringing to our emergency the accident cases. We tell them this is the precautions you take, this is the precautions, and then they were very enthusiastic. They learned also. And when you said that when the bone break and it is looking outside, okay. So one of the ways person dies in an accident in the first 1 hour is by bleeding. It can be external bleeding or internal bleeding. So that is the reason we ask you to bring the patient to hospital faster. So if it is an external bleeding, so all you can do is just put pressure on the wound. Stop the bleeding somehow. Okay. Apply a splint. The minute you immobilize the bone, whatever the blood which has come out becomes a clot and stops further bleeding. It's called tamponade effect.
Okay.
Okay. So try to stop the bleeding by direct pressure. Wherever it is, you can just apply direct pressure. Like if there's a can or a water, oil which is leaking, what you do, just put a finger on the hole so that it stops leaking. It's the same. Put a direct pressure on the bleeder so that it will stop bleeding. That's the first thing. That means half of the thing you have already done to save the patient. Okay, so stop the bleeder. Now make the limb straight if possible. If it is not, just splint it in the way it is. Further, it doesn't move and cause pain. If you splint the limb or hand, whatever it is, pain comes down, bleeding comes down. It easy for transportation. So that's why splinting is very important. Splinting can be many ways. If you don't have a formal splint of which we hospitals use, you can take it straight wooden planks or logs there, to put two together and tie it with a rope.
Okay.
Not too tight, as I told you, not too tight that circulation is stopped, but tight enough for the limb to be immobilized. Okay, so in these ways you can do it. If you are afraid of the bleeding blood, then wrap the limb with a blanket or a bed sheet or a towel or something where you don't have direct sight, and then transport him so that at least you will have a feeling that okay, I did not touch blood and all. Okay, but as I said, blood like that will not transmit diseases just in like that. We don't see such kind of diseases yet, and transporting within 1 hour and a safe transport is always mandatory for accidents. Always be careful of the spinal cord, and if the patient is actually life threatening and gasping, then forget about the spinal cord, but just let him take to the hospital is also we try to tell people. But safe transport is always efficient, and believe me, I have treated thousands of trauma patients in my emergency, and getting him safe and faster way, we have given very good quality of life to them after healing. Most of the time accidents, not only the person, sir, I'm telling you, the whole family gets affected, and you don't know the cost of treatment they undergo, the bedridden patient, and it's a lot of pain to the family. And usually the people who are transported are also the breadwinners, family breadwinners, and if they are getting affected, the whole family gets affected. So my suggestion to all of you, when you hear all these things, this session is given to make you aware of the situations and do a prevention and know the first aid, not to scare you, but to make you give more information so that you can be more preventive. You can prevent these things. And one more suggestion I can give you is have health insurance, ample amount, because in future the treatments cost is going to go up. Even though Prime Minister has promised Ayushman Bhav and we have Arogyasri, all these schemes, and they will be little out of reach, or may not be covering all the illnesses what you have, and they may be covered only in the government hospitals, where the time taken for the treatment may be a little more than what we can expect. So having health insurance doesn't hurt is what I feel, and I've seen many patients who are actually benefited with taking health insurance than non-benefited. So that is one suggestion I can give.
And this is a common scenario, sir. Normally elderly people at home may have chest pain. So what can be done when we have chest pain? So again, in Indian settings, they will give some water. They will make them to drink water and sit and call for ambulance. Before ambulance comes, is there anything can be done?
Yes. So that's a very excellent scenario what you said. Chest pain, the most commonest symptom. It's called a symptom. That's because the patient perceives the pain. That's why it's called a symptom. It's a chest pain, which is very common we see in emergencies. So why do chest pains occur? Okay, so this is the chest, right? We all know this is the chest. Okay, chest has many organs from outside to inside. I'll just mention from outside. Outside you have a skin, you have muscles, fascia, tendons, you have rib cage, sternum, ribs, and cartilage which is attaching to them, and inside that you have pleura, lungs, inside that you have pericardium, heart, and below that you have a windpipe and then a foot pipe, that is esophagus, and behind that you have some other nerves and blood vessels and other things, and then you have a spine, and then you have a skin at the back. So this many organs are there in sequence. So you have a diaphragm, which is the biggest muscle in the body, which is separating your chest from the abdomen. So that's a big dome which is covering like this. And once you come to the abdomen part, is near the chest area, we have a liver, you have a gallbladder, you have a pancreas, you have a spleen. So, and you have intestine below that.
Right.
Literally all the major organs are here in the chest. So wherever you have any issue, the symptom you perceive is a chest pain. You understand?
Right.
So that's why I told you this is the commonest symptom, which is a chest pain. Okay. So how do you differentiate between a heart pain and a chest pain? Now you know the difference when I use heart pain and a chest pain. Okay, heart pains are usually very severe, sir. Very severe. It's like 10 out of 10 pain score. Like pain score is how we assess. So if 0 is no pain, 10 is the most severe pain. So what is your perception of score out of 10 is called a pain score. So when we assess a pain, we always have to ask the patient, what is your pain score? You have to teach him many ways. Like, you can tell 0 to 10, or you can tell this much to this much, or you can tell height wise, or you can tell severity, like open your finger. So as long as the patient understands what your question is, he should be able to tell you how much pain he has at that particular.
Normally it can be easy
pain.
Yeah,
Yes.
what is the rate of the
Rate of the pain? Yes, exactly.
1 to 5.
1 to 5. Even that you can ask. Very simple. Or you can just tell him 100 rupees. How many rupees of pain you have? That it's easy. But illiterates usually understand in this way.
Oh.
Literates usually they understand 0 to 10 scale. They'll understand. So mainly the purpose of this point is like you need to ask them what is the severity of the pain. First thing, is it a sudden onset or a slow onset? Was there few days before now, whether he was suffering with less pain, now it has become more. And then third one, is it radiating anywhere? What do you mean by radiation? That means all our nerves which are originating from our brain and spinal cord, they give distribution. They have different nerve endings which supply to different organs. So when one particular nerve organ is perceiving pain, it can radiate the pain to other nerve endings. That's why a pain, heart pain which you are having here can go to jaw, can go to left shoulder, can go to the left hand in the medial part, inner side of the left hand, can go to back. Sometimes it can go to right shoulder and right inside of the hand. So this is called radiation. So when you have a radiation, it is significant.
Okay.
It is significant. Okay, so you have onset, sudden or slow, you have a severity, and you have a location where exactly it is, and you know where it is radiating. And again you should ask, does it subside? Is it a repeated pain or the first time pain? Sometimes if it is repeated pain, they will know, okay, this is the same pain which I got as a heart pain. This is the first time. Okay, first time, did it come down any time? Did you take any medication? Is it increasing on exertion? Like, walking it increases, running it increases, sitting it subsides. So these are the main history you have to take. It will help us in differentiating classic heart pain versus a non-classic chest pain.
Okay.
Okay. So once you feel that it is a classic heart pain, yes, that means you are dealing with a heart attack right now. Don't take any other suggestion to any other diagnosis into the mind. You need to take him to the hospital right away. So most of the people waste their time in taking to nearby smaller clinics where they don't have advanced, either not even ECG. So don't waste your time in taking a place where they don't have ECG or they don't have a person who can diagnose an ECG. Okay, so go always to a place where at least where they can get an ECG and they can be able to confidently tell, okay, this is not a heart attack for you. Okay, so most of the times what ECG what we do is a 2D search, like means it's a time now. How is your heart now is what the ECG tells. So sometimes we will require you to take ECG at a frequent intervals like a half an hour time or 40 minutes time, 1 hour time. So we will give you some medicine and then we'll let you stay there for half an hour to 2 hours. We'll do serial ECGs and we'll see any significant dynamic changes in the ECG.
Okay.
So when we see the dynamic changes, even now if the heart is normal, after half an hour if it is not normal, we'll immediately know that it is heart attack.
Right.
So when you are having this particular heart attack, it is very important for you to reach a hospital, a cardiologist, a cath lab, where they can do an angiogram, emergency angiogram, and they can see which of your blood vessel is obstructed in your heart and they can open it up. That is the best treatment possible for a heart attack.
Right.
Okay. And then sometimes at night, cardiologist is not available but you are in the hospital, sometimes they can give you a medicine which dissolves the clot. It is also an equally good alternative. So don't argue with them that no, I came for a stunt, you have to put me a stunt. No, it's not like that, sir. If the time permits, they will give a medicine which will dissolve the clot that is equally effective in the first 6 hours of your heart attack, equal to putting a stunt. Okay. So this is what they do in the hospital. So what your question was, what can I do at home to prevent this? Yes, sir. Heart attacks, what happens when the heart attack is, there is some cholesterol which is there in the blood vessel. So what it causes is it decreases the blood flow. Correct?
Right.
There is a road. You have parked your car beside the road which is coming onto the road. Now what will happen to the traffic? It slows.
Right.
Correct? It slows. Like you, one other person has parked another car behind you, another car behind you. What happens? It becomes a traffic jam.
Yeah.
That means blood also, it is going freely, there is some obstruction, it slows down. Once it slows down, whatever happens, the blood cells which are there, they start clumping together. Then they become a clot. Once it becomes a big enough clot, they will completely obstruct the blood vessel and you have a traffic jam. That is when you don't get a blood supply distal to the clot, and that is when your heart attack occurs. So this is what happens in a heart attack. So what you can do at home is you can give him aspirin.
Okay.
We call it as dissolvable in aspirin, it's called Disprin.
Okay.
So the Disprin 325 mg tablet can be taken. That means you can just put it in water, it will dissolve and drink it, or you can just put it in the tongue and it will dissolve in the mouth itself. When you do that, you prevent clotting.
Okay.
Clumping together.
Okay.
Okay, that's usually immediate effect it starts and it decreases the severity of the heart attack.
Okay.
Okay, so does everyone can take this tablet? No. Some people who are having active bleeding, that means they are already bleeding somewhere, are not supposed to take Disprin, sir. Okay. Any other alternative medicine? Usually there is no alternative to aspirin. But being said that the blood pressure is high, the pain is very high, what we tend to give them is nitroglycerin, sublingual nitroglycerin, what we give, sorbitrate. Usually 2.55 mg is what we give, but we put it under the tongue so that it will again swallow. What it does, it decreases the blood pressure and decreases the load on the heart.
Okay.
And then it decreases the symptom,
Okay.
heart pain symptom, but it doesn't prevent heart attack.
Okay.
As such, it doesn't cure, but it decreases the symptom because it decreases the load and decreases the symptom. Very precaution we have to take is, once you take this sorbitrate, you have to make the patient lie down on a flat surface. As I told you, because the blood pressure comes down, he will feel giddy and he will fall. That will be another complication to the patient. So when you are taking a sorbitrate, you have to be in a lying down position or recovery position if he wants.
Okay.
Okay, so this is the precautions you need to take. So these are the only two medicines we suggest them to take during a heart pain, but other medicines, they don't actually recommend it without a doctor's prescription or doctor's advice. So as I told, the minute you get a chest pain, think it is a heart pain, go to a professional, get an ECG done, see if it is not a heart pain. If they want advising you serial ECGs, get it done. Don't be in a hurry to go home or do anything. Get yourself evaluated and get done. Who will get more chest pains, sir? Who will get more heart pains? Smokers. The people who are drinking alcohol, the people who are having diabetes, hypertension, obese patients, the people who are having high cholesterol in their body. So these people are more tend to get heart attacks, along with the people who are having a family history. That means father, mother, brothers, sisters who are having a heart problem in their life at a young age, then you are prone to get at a young age. That is the reason we have healthy heart checks, regular intervals. Every year you can get your cholesterol and other things checked, ECG checked, 2D echo checked, meet with a cardiologist, and then have a healthy lifestyle. You can always prevent a chest pain.
Sir, one more thing we have to discuss is about choking. So choking can be elderly or of any age. So
Okay.
when someone is choking, how to identify he is choking and what is the way to bring him out of choking?
Okay, so choking is also very common, especially in small infants and kids where they feed when they are lying down position. And as I told you, it's all depends on the anatomy, so our body, how it is. So nose, throat, and then lungs. This is the airway. Mouth, throat, again esophagus. This is the food pipe, foodway. Windpipe and food pipe. It's easy to identify. Now, when it is up and it is low here, when it goes again, windpipe is above and this is below. That means they cross each other in the back of the throat. Now what happens? Air going into the food pipe is okay. Okay, but food and water going into the windpipe is what choking is. That means when here where the food pipe is very small, you take a big chunk of non-vegetarian or fish or something or a food particles which is going into the lungs. If it is a small which is already passed and goes to the lungs, it's called aspiration. But which is obstructed here is called choking. That's what choking means. Okay, so when choking happens, how do we know is what we are. The person is able to bigger adult is able to tell or to what he says, he'll put his hands like this and that means he's choking. Then we have to ask him, are you choking? Then they'll nod, they can't answer because voice doesn't come if it is choking. So they'll answer yes, like this they'll nod. So that is when you know that the person is choking. For infants, small babies, where they can't talk or do two things, they'll start becoming blue. They'll stop breathing, they'll grunt. This kind of sound comes and they start turning into blue.
Okay.
That's why you don't feed people in dark.
Okay.
You should feed kids in the very lit room because you know what they are eating and how they are when they are eating. Especially feeding is never done when it is dark. Even when you are breastfeeding the baby, during sleep, they sleep beside the baby and they give breastfeed. This is very wrong. Switch on the lights, sit, make the baby in 15 to 30 degrees angle and then feed the baby. In this way, you prevent aspiration and choking. Okay. So choking, what happens when it happens to the choking? If it is the baby, sir, which can be held in the hand, you hold the baby in the hand like this and then you can give in the front, you can just press like a CPR. You can press the baby 5 times here and then you can turn the baby back and then you blow the back here 5 times. In this way, whatever is obstructed in this, it will come out.
CPR in the same place where
we do
between
yes,
sternum
on the sternum, lower half of the sternum between the nipple line and the midline.
How many strokes?
5, sir.
5 strokes.
5 compressions and 5 strokes at the back.
Okay.
Compressions and back. If you do like this, usually that comes out.
Okay.
Okay. For adults. So if you stand, we'll show. So sir, you put your hands like this. Hands like this. Sir, are you choking?
Yeah.
No sound, only that.
Yeah.
Sir, are you choking?
Yeah.
Now he is choking. So I have to stand behind him. Okay. So I have to lift the hands like this. I'll put the patient's leg little far away here. So it's a standard ease position, not attention position. Standard ease position, and one of my leg will be in between the patient's leg like this, and then support the patient with my body like this. Okay. In that way, if he becomes unconscious, he will fall on me rather than we both fall down. Okay. Now with one hand, I will make a fist like this, and here below the sternum, below the rib cage here, point out the rib cage here. This fist goes here like this, and the other hand will go and push the fist up like this. Okay, so here it goes up. So the pressure comes like this, up, up. So the minute you start doing this very hard, whatever is in the throat will come out because of the pressure. This is called Heimlich's maneuver. Okay. If the person is adult like sir, same height and same thing, you can do it this way. If the person is small child, this much height, you can kneel down behind the child and can use only one hand to give the thrust. So in that way, whatever is obstructed in the throat will come out. Sir. During this one, if there's a bigger one is obstructed very hard and it's not coming out, then the patient stops breathing, right? There is no oxygen. So he becomes unconscious like this. If he becomes unconscious, what will you do, sir? Same. Like you make him flat, and what we did for unconscious patient there, do CPR, check pulse and breathing, do CPR, and then whenever you are before giving birth, open the mouth and see if you can see. If you can see, remove it. If you don't see, just leave it. Then do CPR. That's all.
Okay.
Nothing
And
more.
how many thrushes is there any?
No limit, sir. As long as it comes out, it can do it, sir.
Okay.
Okay, not on the rib cage, below the rib cage. When you palpate the bone like this, if you do it, come down, you will see a dip, sudden
Right.
dip with the edge of the bone. Below that, you have put.
Yeah, just below the xiphysis.
Yes, in between umbilicus and the bone, you have to put your hand and then do it. That is choking. As I told earlier, knowing them. So the way I explained to you is first why it causes, what happens it causes, how to identify it, and what to do in such instances, and what is the treatment to it. So for anything which you want in a medical way, this is the way you need to understand it. The minute you understand it, you know where to go, whom to approach, and what. Instead of going to many doctors also, if you understand the problem, it's very easy for you to approach an appropriate person. And during emergencies, always think of the life threatening first. That means in a chest pain, example in a chest pain, I always, my as an emergency physician, my brain always go to heart attack, because that cannot be taken back. If that is the real scenario, and if I don't give appropriate concentration on that, and the patient dies, I cannot take it back. But if it is not, it's still okay for me. I am happy that patient is not having a heart attack, and I can prove it that it is not a heart attack, and still he is okay. So always, if you have a problem, think of the emergency life threatening first. Once if you think of the life threatening, get it ruled out, and then the common things can be treated anyway.
Yeah.
So that is my
False
suggestion.
positive is better than a false negative.
Yes, sir. Yes.
Thank you very much for your time, sir.
Thank you so much for giving the opportunity, sir. Bharadwaz, sir, thank you so much for
Yeah.
giving this. And if you have any more sessions, we can do much more in this. In this session, we can educate the people more.
Yeah. What we ask our audience is go through the episode, and if you have any questions, let us know in the comments, and sir will be addressing the comments in our next meeting. Thank you very much.
Thank you so much.